The health wrap season 2. We
Yeah,
told them we'd be back. They didn't believe us, did they? They didn't think we could do this from what, the basement?
they thought we had fake news. They didn't believe us, but here we
Hey,
are.
hey, faith. It's called faith, but also some amazing blessings. We've been
Yeah,
blessed with some loyal watchers of the health wrap who have proven our vision true, that this is information that people can use, information they can process, information that they can share with their family and friends. And stop right now. Go ahead and share the show so people can watch this show. This is the season opener for season 2. We said we had some big news, and we don't generally keep secrets, but we had to keep this one, right?
yes, we absolutely did. Well, of all the good work that we've been doing to educate people about what's going on with COVID-19 and to talk about health disparities in the underserved communities, we have a partner to join us, and that partner is the Kellogg Foundation.
Absolutely. So, and I say partner, it's partners, because that's really what it takes. It takes everybody working together to make this happen. And we first reached out to Kellogg in part because we had a relationship and done some prior work with Kellogg, and so we knew some folks there, and they sent us to some other folks and other folks. And then, as with any project, as you're praying on it and trying to push it through, you kind of feel like you're hitting a roadblock. And so I then reached out to another client, and that other client was just amazing, because all of a sudden she said, "Well, why are you looking anywhere else? You should do it with us." And so the other partner is Simmons University. And Simmons University is located in Boston, Massachusetts. And what's really exciting about this is we will be working with the good folks in the school. It is the, wait for it, it's the Gwen Ifill School of Media, Arts, and Humanities. Carla, you know how huge that is, right?
Oh, it's absolutely, and especially because he was one of our colleagues in the National Association of Black Journalists, an illustrious career with PBS, and succumbed to cancer. So I know she would be proud about the work that we'll be doing, and then that gives an opportunity for us to work with journalism students there, and also students in the nursing school.
Absolutely. And so you'll be meeting our interns that'll be working on the show with us as they come on board, and you find out a little bit about their background, and you'll just see an evolution right before your eyes. It's getting everybody involved and all hands on deck. And we're just thrilled about that. And so we thank God. We thank all you all for being loyal watchers and staying tuned. And what else can we say, Carla? You keep the blessings coming, good Lord. Keep them coming.
Yes, and what I'm thankful for, Carolyn, is that you calling me that day as we were calling each other like many friends and family at the onset of COVID, and that we said, let's use the skills that we have to serve the community and to help calm fears with facts.
Well, we are continuing to call on a lot of our good friends who are in the industry and the business to give you the best quality produced show. We got somebody at the producer reins, Roshonda Pratt, who, man, I don't know, I can't tell you enough. That take 30 minutes of this show, right? But you'll see
Yes.
it in the product that will be produced as we move forward. And we actually even called on one of my old colleagues from ABC for our cover story. And that's a new feature to the Health Wrap. We'll be doing cover stories that are a little bit longer, a little bit more in depth. And the thought is, we want to get you thinking about some of the implications of things that are happening around you and your health. And in this case, we've been having this discussion here internally, and that is how much of the decisions, or how many of the decisions about our health, are being made with a concern for profits and politics first, right, Carla?
Yes. So we're going to go to the state of Florida, and that's where the story begins.
When we think of Florida, we think of sand, sun, and fun. Florida is one of the top tourist destinations in the U.S. But like the rest of the country, Florida is dealing with a fragile economy, racial discrimination, Black Lives Matter protests, and of course, the coronavirus. This summer, Florida was one of the top coronavirus hotspots in the country. The number of cases has since dropped, but they are by no means out of the woods. Just a few weeks ago, Florida Governor Ron DeSantis announced that many businesses, including bars, restaurants, and even amusement parks, can open at full capacity. This decision surprised a lot of people.
But I was really kind of baffled because I'm saying this man is trying to kill us. That was one of my first reactions, because Florida is not out of the red yet. We are still in the danger zone. He's trying to please Trump. He cares about the people in Florida, but he is more loyal to Trump than he is to the residents in Florida.
Beverly has diabetes, and she's not the only one that's vulnerable to the virus in her community. African Americans and Latinos experience the highest COVID-19 infection and mortality rates nationwide.
I've been in medicine for 30 plus years, and these are the same people who have been dying of high blood pressure, diabetes, strokes, and COVID came on and just amplified the stresses and the problems and everything they've been going through and increased the unnecessary deaths.
We started talking about this dual pandemic, the pandemic of coronavirus and the pandemic of racial and social injustice. And this has been a very stressful time, I think, for African Americans, regardless of age. It's a stressful time. It's an extremely difficult time.
As of now, there is no cure for COVID-19 or racial profiling. Last May, Dr. Armin Henderson was handcuffed in front of his house while loading supplies for the homeless people he serves. The police officer demanded answers.
He asked me if I lived there, what I was doing, and I told him. We had a short conversation. He started to berate me by pointing his finger at my face and telling me that I should call him, sir or sergeant when I'm talking to him, etc. He didn't have a mask on, and the police officer just seemed perplexed when I called for my wife, and she came outside in her pajamas, was able to de-escalate the situation, and he took me out of handcuffs immediately.
Dr. Henderson's work is important. He estimates 50% of the men living on Miami streets are Black and have had run-ins with the law and been arrested. Their current outdoor lifestyle has kept most of them COVID-free for now.
What I've seen when I'm testing individuals is that because they've been so disconnected from the normal population of people, it's pretty much shielded them from the virus because they're outside, because they're away from, the majority of individuals. As we start to open up the economy and individuals start riding the buses again, and people don't have access to masks, and you have these large outbreaks of people, it's going to spread to the unsheltered population. And when it does, it's going to hit everybody.
Florida was no different from the rest of the country. The disparities are already there. So of course you put in this infection that gets people who are already down. Yes, we experience twice as many deaths when you compare it to other people. Hispanics also, where you didn't have as many in some parts of the country, but in Florida, where we have a large percentage of poor Hispanics also, you saw the disparities.
The congregation that I'm blessed to serve is absolutely a congregation that has several risks, and persons would even call us high risk for the transmission of COVID-19. I would say in at least two areas. One, we're at least 95% African American, and the reports are clear that the adverse impact on our community, on my community, is greater than others. Health care for us is a little more scarce than for other communities.
The governor also insisted that schools reopen and threatened to fine those that did not.
I'm not a conspiracy theorist by no means of the definition whatsoever. But when they're insisting on sending our children back to school, it's like they're pimping our children for their political agenda. And all our classrooms and windows, doors are always kept locked. So when you have classrooms that are locked, stagnant air, the air conditioners, half the time are not working, we're going to end up having a pandemic within a pandemic. And, we're not even in the second wave. We're not even in the second wave. And to think that children do not die from COVID-19 is the most ignorant thought process I have ever seen.
I hope that the folks are clear in understanding that the risks are still high. And I don't know if the benefits of a paycheck outweighs like what I've experienced with some of my patients who are still having brain fog, who are going to be oxygen dependent, and unfortunately some who have died, regardless of age.
Really understand the impact on the communities of color, the Hispanic and the Black community, how COVID-19 has affected those communities and the death rate within those communities. I look at it almost like genocide.
Life on college campuses has also been affected.
I want to be able to go on campus. I want to be able to interact with people and learn how to do things physically in person rather than to have to send videos in to my teachers for them to see if I'm doing it correctly. Because I'm not going to get the full experience as I would any other nursing student.
I think the reopening of the state announced by Governor Ron DeSantis can be to teens and to young adults kind of an invitation to go out again to bars and to restaurants, and an invitation to stop wearing a mask and just not listening to CDC rules. We'll also see some students who are going to continue to practice social distancing and avoid large crowds because, again, some of these students have seen how the coronavirus has affected people in their community, in their family, and the effects the long-term effects that it will have.
Everybody's wearing masks. So there is social distancing happening still at the parties because kids are afraid. People are still getting sick, whether they talk about it or not. And the thing is, people are still dying from it. Whether people want to admit it or not, people are still dying.
We've had over 14,000 deaths in Florida. He's following in the footsteps of Trump. He wants to make Trump look good. He knows that Florida is a battleground state. This is a big contentious election. Florida has always been in the middle of contentious elections in the past.
For whatever reason, and unfortunately, they're not going to protect you. So you're going to have to do everything you can to protect yourself. So call it whatever it is.
We can't see it, we can't taste it, we can't hear it, and we can't see it. So I'm make sure I'm keeping myself safe.
I do wish that the governor had been clearer about continuing to follow the CDC protocols. I do support the concept of trying to figure out how to do this in a balanced way. We have hundreds of thousands of people in Florida still out of work. I don't know how they can continue but so much longer. So we have got to get people back to work, but at the same time, we have to do it safely. So it isn't an either or, it's a both.
Interesting things happening in Florida. It's a lot for us to think about and have discussions with our families as we continue to make daily decisions about our health.
Absolutely. And Caroline, I remember when I first heard the story about Dr. Henderson and him trying to help people, and instead of people letting him do his job, he has to have this confrontation with the police. But fortunately, people like that, they understand that things happen and they continue to do the good work.
Absolutely. Absolutely. Well, talk about work and the discussion of whether or not health decisions are being made with profit more for people. We turn to the NFL, where in the NFL, Cam Newton, who is the Patriots' new quarterback, has tested positive for coronavirus. And he's encouraging everyone to wear your mask and keep the distance.
Absolutely. And Caroline, I'm sure everyone saw in the news about what happened in Nashville with the Tennessee Titans. And you're looking at several incidents that have occurred. Actually, as of today, there's some 20 players and staff that have contracted the virus, which caused them to cancel some games. They're back on track, but we're going to be really looking closely because it's a little unusual because they have more players and staff who've contracted the virus than any other NFL team.
A lot of people are questioning the decision to go back and whether or not the bubble worked. And I'm sure as we continue to follow it, we'll learn more about that and continue this discussion as well. We have more coming up in the Health Wrap. Stay with us. We'll be right back after this message.
How to clean and disinfect your home if someone has COVID-19. For common areas of the home. Each day, clean and disinfect high-touch surfaces and items. High-touch surfaces include tables, countertops, light switches, doorknobs, and cabinet handles. Put on disposable gloves. First, clean the surface with soap and water. Then, use a household disinfectant. Read the label to see how long you should keep the disinfectant on the surface. Have good airflow and ventilation. Follow instructions about rinsing off chemicals. Be sure to put products where children cannot reach them. To clean electronics, follow the manufacturer's instructions. Or use alcohol-based wipes or spray containing at least 70% alcohol. Wash dishes and utensils with soap and hot water or run them in a dishwasher. For sick areas or rooms of the home. A person who is sick should stay in a separate area or room and use a separate bathroom if possible. Only clean these areas if something gets soiled. This will help limit your contact. Have the person who is sick wear a mask. A caregiver may also wear a mask. Dedicate a lined trash can if available. Remove the gloves and wash your hands with soap and water for at least 20 seconds. For more on cleaning and disinfecting your home for COVID-19, visit cdc.gov/coronavirus.
Good advice from the CDC. We're continuing to work with them with messaging as well. You know, there's so much that we are still continuing to learn each and every day about COVID, its effects once people get it. A lot of folks have been watching Washington, D.C. and our president as he has come out of the hospital and returned to the White House. But folks are still looking to see if there are signs of symptoms that still exist and trying to determine how much time the virus will take its course or has taken its course in his body. So lots of discussions about it, and even the drugs he's taking.
Oh, absolutely. And you know, there's always been a lot of talk, especially in the African American community, about taking drugs. If they come up with a vaccine, do we want to go ahead and take it? Well, the two presidents have joined forces at the Louisiana colleges, the HBCUs, Dillard and Xavier, and they have joined the vaccine trial. And they've gotten mixed reactions. Some people keep bringing up the whole Tuskegee experiment. And those are the older people that remember that, mainly younger people who taught about it. But they have asked, students, they think they should participate because they need African Americans and people of color in these trials. Right now, there are 200 people locally taking part in this vaccine study. It's a vaccine developed by Pfizer and biotech. So they have 120 sites around the world, and they happen to, the two presidents say that they want to join in because basically, they're in a state, Louisiana, where most of the people who are dying are African American, but African Americans are only 33% of the state of Louisiana, and they're 48% of the deaths.
Our producer, Roshonda, raised the question earlier this week to folks about whether or not they would participate in the vaccine if given an opportunity. And, you see, nope, the Tuskegee experiment should have taught us all. That's from Texas, someone from Texas, Rhonda Gittes, who gave us that response. Kevin Felder from South Carolina said, I would like to offer another perspective. Without Blacks enrolling in clinical trials, no one will really know how the vaccine will respond in Blacks. Good point. Research with the right motive plays an important role in the evolution of modern medicine. Very strong quotes. So this is Mississippi, Andrea Morris. You see this one, Carla?
Yes, understand about the mistrust. However, that talking about, again, the Black population is misinformed about vaccines, and that drug companies are going to recruit and they need us to participate. So it is a difficult decision, but we understand there is going to be mistrust again because of generations of mistrust. But that's how we have to test the drugs. And it's, you know, you ask yourself, am I brave enough to do this? Well, there's one lady who is a news anchor, and she's not only telling the news, she's making the news. And remember Dawn Baker from Savannah?
Yeah, how's she doing?
Mm-hmm. Well, I talked to her after she had taken her second shot. You know, the first one she took, it made like national news, world news in July. And then in August, she took the second shot. But talked to her, and we can see how she was doing a few weeks ago.
Dawn, you not only deliver the news, you have been making the news as the first person in the U.S. to get a shot in the phase 3 of the COVID-19 vaccine trial last month. And you got your second shot on Monday. How are you feeling now?
I feel great. I've been very fortunate. The first vaccine I took the day after I had the kind of heaviness in the arm, similar to when you take a flu shot, the very next day. And then after that, I got this crazy burst of energy, and I've had more energy than I've had in years. You know, working a night shift, I work 3 to midnight, Monday through Friday. It is a bear. And then getting older on that shift too, it is a bear. So I've enjoyed the boost of energy. And the second shot, I will say that that symptom came on earlier. By the end of the day, I could already feel my arm feeling sore. The vaccine area was warm, and I had a headache. And those are the only symptoms that I've had. And the very next day, I felt a little tired. But the day after that, I believe, which is today, I have been feeling really, really good. This vaccine is meant to boost your immune system. So if you were to come in contact with COVID-19, you'd be less likely to get it. I'm doing everything I can to not come in contact with it.
So Dawn, of course, you really don't know if you have the placebo or the real drug. Is that correct?
I don't, but I just kind of feel like I do because of the surge that I've gotten in my body. I can't imagine that endorphins have lasted this long. And when I mentioned to my doctor about the headache and the warmness where I thought I had a fever, and I forgot to tell you, I did have some chills that night too. And he said, oh, he goes, I have no idea what you got, but it does sound like what happens to the healthy body when something is introduced to it, like a vaccine, to boost the immune system. So we're just guessing right now. We won't know until it's all over. And it is a 2-year process for the entire vaccine study. So what I have to do now is I have a total of 5 more in-person doctor's visits. And I, right now for this first week, since I got the second shot, I'll be using an app on my phone where I log all of my symptoms. I take my temperature. Is it your tracking system that you have? Yeah, so I try to do my temperature every day. I talk about any aches and pains I have, headaches, you name it. If the vaccine area has changed in any way, they log all that, and it's synced real time. And so if I do have any kind of issues or feel differently, I'm supposed to contact the Meridian Research Clinic here in Savannah.
You know, it's been hard to get African Americans and Hispanics to participate in trials. What can you say to encourage people? Because this is the way they find out. Remember, years ago, women were not included in trials. But you're a woman, you're an African American, and they need African Americans and Hispanics to see, because we have so many high rates in the states of COVID-19. What can you say to encourage people to participate in trials?
Well, you know, I will tell you, first of all, I'm going to tell you that I understand why, especially Black people, are afraid. There has been a lot of bad things have been done to Black people in America. Experimentation when it came to health, from the Tuskegee experiment, which lasted a whole 40 years. That's generations of our families who may have been trapped in that. Also, I can't call his name right now, but the guy who's credited being the founder of the father of OBGYN, well, he experimented on a Black woman without her permission. So I understand people being concerned. I get it. But I also understand that we're now living in 2020. And I will tell you that I had my concerns. If it weren't for my doctor, Dr. Paul Bradley, who is the chief investigator with the Moderna vaccine trial, I probably wouldn't have done it either. He called and asked me if I would take part in the vaccine study. First question I asked was, is this live? He said, well, why would I put COVID-19 in your body? I said, I'm just asking, is this a live virus? He said, no. I said, can I get COVID because of this vaccine? He said, no. I said, am I more likely to get it because of this vaccine? And he assured me that I would not.
I have to tell you, one of the things I've been thinking as we've been talking about this vaccine and whether or not you participate in trials is the reality is, you have to really take a role and manage healthcare. And that means knowing, if the doctor comes at you or the nurse comes at you with a needle, you need to ask them what that needle is and why are you getting that shot. And so it's actively taking a role. I've had friends that have joked about our family, when somebody gets ill or goes into the hospital, somebody is with them 24/7. The nurse is generally saying, do you need a heated blanket too? And we're saying, yeah, because I'm not going anywhere, right? Because I want to know what's going on with my loved ones, in the care of my loved ones.
Oh, absolutely. You do want to watch anytime, not just during COVID. I mean, my mom's a retired nurse, as many people know. And so are my sister-in-law's nurses, and got doctors and nurses that are friends and in the family. And they always say, right now, especially, people are stretched thin. They're stretched really, really thin. And it looks like there's an uptick across the country in many places. So they're going to be stretched even more thin.
Absolutely. Well, we're going to take another break, and this break is brought to you by Dr. Hildreth from Harry Medical, one of our early friends to the Health Wrap. Great to see you.
One of the things that's disturbing about the COVID-19 virus is that 4 out of 5 people who get infected are infected by someone who does not have symptoms. People who study virus spread assign them what are called basic reproductive numbers. COVID has a value of about 4, which means that for every person who's infected, on average, up to 4 people might become infected by the person who's transmitting the virus. That means the number of people infected could possibly double every 6 days. And if you do the math, that would mean that a single person, after 60 days, could be responsible for 1 million infections. So this is serious. The scientific underpinnings of what people are being asked to do are based on what we know about how the virus is spread. The first thing to know is that the virus can survive for hours and hours on certain surfaces. So that if a person who has COVID touches a doorknob or handles a utensil or does other things and leaves the virus on that surface, the virus can stay there for up to, in some cases, up to a day. And that's why the washing of the hands is so important. Human beings, by habit, touch the face many, many times a day. And there's something called the T-zone, which constitutes your eyes, your nose, and your mouth. Most of our skin is keratinized, which means that viruses cannot infect them because they're essentially not living. But your eyes, nose, and mouth have mucous membranes, and those cells are perfectly happy to accept viruses and become infected by them. Coronaviruses are indigenous to bats, and because of the genetic differences between humans and bats, those viruses don't normally infect humans. They require an intermediate host. So what happens is the coronavirus infects another animal, adapts to growing in mammals, and then it's able to infect humans. For SARS, it was cats. For MERS, it was camels. And for this virus, we don't know what the intermediate is, but the main point is that unlike those other viruses, this virus has adapted to be able to be transmitted from humans to humans. In the case of COVID-19, we are in fact the vectors because we're transmitting the viruses to each other. So the goal is to eliminate the vectors, and that means that we have to protect ourselves, and by doing that, we protect everybody else. So don't be the vector. Really, by doing what we're doing, social distancing and not being vectors, we're actually protecting a large segment of our society. So each one of us can play a big role in saving lives. By taking care of ourselves, we're actually taking care of each other. And that's what this is really all about.
As always, sound advice.
Yes, and every time I see that piece, it's like a whole quick, in-depth education about COVID. And isn't it amazing when you start seeing that spread and seeing how it spreads? It just makes you think, wait a minute, I definitely need to keep that mask on and social distance.
Absolutely. So you've had an opportunity to see some of our changes so far, and we're wanting you to join the conversation and let us know what you think. DocsOnCall.health or hashtag DocsOnCall. Carla, you've been hanging out with one of the area churches and learning about how they're approaching COVID.
Yes, this is St. Philip AME Church in Atlanta, Georgia, and they've always ministered outside the four walls. But you know, with COVID-19, it brings some unique challenges on how can we continue all the programs that we've had. Well, you're about to see how they are saving souls and saving lives.
Ramona Hill. I'm the Vice President of the St. Philip AME Church Health Ministry in Atlanta, Georgia. I think it's important for any community to target health disparities. Unfortunately, that is what we face as African Americans. We are delayed in how we proactively take care of ourselves. We're delayed in seeking the proper medical treatment. We're delayed in intervention. We're delayed in everything. So we have to take it upon ourselves to take responsibility for our own communities. Yeah, so of course the spirit is high, ushers in the presence of the Lord. And it's just the complete atmosphere of praise. We're fortunate during our regular services when we are in church to exercise on every fourth Sunday from the pews. So it's really just an opportunity now that we're in COVID to continue that level of movement. It's called Spirit in Exercise. And so we were excited to have the opportunity to launch our community or church community into working out. The trainer took us through stretching, through preparing your body to exercise, to move. It is very important that we focus on our mental health, particularly now. There are individuals who are in need of strategies to actually support their experiences with. So in light of that, we are partnered with the American Heart Association Healthy for Life program that offers a program called Mindfulness, Boost Your Mental Well-Being. And in that program, we are happy that we had participants to engage with our licensed counselor who took us through exercises that we can all do in our own homes that would help alleviate the symptoms of depression.
They may stop doing things that they normally would do or things that they used to enjoy, they just don't seem to find much pleasure in.
Part of the Black Lives Matter event, we had COVID testing. One of the things that we do each year is the Reverend George Moore Stroke Awareness Walk Run. This year it will be virtual. I am so excited to invite our entire community to participate. The goal for the walk is 30 miles in 31 days, and it will start October the 1st and it will end October the 31st. We will track our progress through the Nike Run Club app.
So Carolyn, you can see that St. Philip in Atlanta did not allow the COVID to stop them from carrying on the great services they provide the community. We'd like to thank Dr. Wim Watley, the pastor of the church, and Ramona Hill, the vice president of the health ministry. And speaking of health ministries, there's another church that's in North Carolina that they are doing virtual walks to celebrate Breast Cancer Month. And we're going to have something on our Facebook, and you'll be able to see their story with Watts Chapel Missionary Baptist Church. Miss Deborah, my friend there in Raleigh, North Carolina, and how they did their breast cancer walk virtually.
Absolutely. That's a mouthful. Thank you so much. Great story. Great to meet all the folks out at St. Phillips and their health ministry. That's super. We thank you all for watching us on our first edition of our season 2, the Health Wrap. We're back. We hope you stay tuned to us. We again thank everybody. Our team has expanded. We're excited about that. We appreciate some of our early partners. You can see the list of them there. We appreciate them coming along from the ride from day one. We thank them, and we hope to see you all back again next week.